welcome back to part 5 of understanding your shoulder pain. So this is the last portion of the video series. We're going to talk about some self-tests that you can be doing to check if you have some shoulder pain that warrants going into your physical therapist in order to start to get some treatment on it. So we're going to get right into these self-tests. So first one we're going to do is a self-external rotation test. Like we talked about in part 1, a rotator cuff has two big muscles that come off the back. Their main function is to rotate us outwards. So all we're going to be doing, you can do this against a doorway or just using your other hand, is you're just going to be here trying to pull out in this position, but you're going to stop yourself. So I'm trying to rotate out to the side. If you get pain in this area, it might feel like pain up top, it might feel like pain in the back. This is a sign we have some irritation or some dysfunction with the rotator cuff muscle that probably warrants you going and getting this checked out. So that's number 1. So moving into test number 2, this is called the Yoakum test. So this is pretty easy. All we're going to be doing is taking whatever affected shoulder, reach across and grab onto your other shoulder with your elbow down. And all we're going to do is stay holding on to this opposite shoulder and try to raise our elbow up as high as you can. What we're looking for is if you have some pain again on the top of that shoulder, that would indicate we have some rotator cuff dysfunction, something irritated that we need to take a look at. So all you're doing is trying to raise up there looking for pain. You can always self-test on the other side too to see how it feels. Test number 3, we're going to talk about the NIRS test. So you can do this with somebody helping you or by yourself. What we're going to be doing is turning our hand inward so our palm is facing out. And all we're doing is reaching our hand straight above head. And if we get pain at the end range of our motion, so not necessarily in the middle, but as we get up to that top, and that pain is generally going to be somewhere along the top of your shoulder. If you get pain there, again, this is a sign that maybe your supraspinatus, that top rotator cuff muscle, or some of these external rotators that we did with that first test are inflamed or have some irritation for some reason that, again, maybe we need to take a look at and start some rehab on. So that wraps up 3 self-tests that you can be doing to check if you have some shoulder pain or dysfunction. If you have 1 or 2 or 3 of these, even 1 or more of these positive for pain, I would highly recommend going into your doc, your physical therapist, start to get this looked at, make sure this isn't something that's going to continue to get worse. Start the rehab process now so you can feel better doing those activities. So we hope you enjoyed this 5-part series on understanding your shoulder pain. You learned a little bit of something, but hopefully your shoulder pain improves a bit as well. If you do have more questions, feel free to reach out to us. We would be happy to offer you a free phone consultation, answer some of those questions that you still might have about your shoulder, and if need be, ultimately get you into the clinic so we can start improving that shoulder pain and get you back to the activities you love.